Happens so many times in these hospitals, and only the insiders will know. So we feel great that we are working in that kind of environment, not just for the doctors and the people who are working in that hospital. We have thousands and thousands of these patients who have come inside, come to this hospital, got treated, and they all are, there's so many of them, I would say, that they have come out of their agony, disease and the pain. One of the commonest thing you all know the human being suffer is arthritis or a joint pain. Difficult. So we call that as the pain coming in the way of activities of daily life. You see, the people have headache once in a year, they manage it. Okay, it's common. Today headache has come and tomorrow it's gone. It's okay. But prati divsa headache bandre manage madakagalla. It affects their life both physically as well as emotionally, mentally, family, socially and everything. So the pain is something which disturbs all aspects of life, as well as it also disrupts them both financially, socially, as I told you, in all aspects of their life. ಈ ಮೆಡಿಕಲ್ ಸೈನ್ಸು, ಈ ಡಾಕ್ಟರ್ಗಳು, ಹಾಸ್ಪಿಟಲ್ಗಳು ಯಾವ್ಯಾವುದನ್ನು ಮಾಡೋಕ್ಕಾಗಲ್ಲ ಅಂತ ಎಷ್ಟೊಂದು ಜನ ಪೇಷಂಟ್ಸ್ಗಳಿಗೆ ಗೊತ್ತಿರಲ್ಲ. ಏನೋ ಒಂದು ಮಾತ್ರೆ ಕೊಟ್ಬಿಟ್ರೆ ಹೋಗ್ಬಿಡುತ್ತೆ ಅಂತ ತಿಳ್ಕೊಂಡು ಬಂದ್ಬಿಟ್ಟಿರ್ತಾರೆ ಹಾಸ್ಪಿಟಲ್ಗಳಲ್ಲಿ. ಇಟ್ಸ್ ಸೋ ಡಿಫಿಕಲ್ಟ್ ಫಾರ್ ದ ಡಾಕ್ಟರ್ಸ್ ಟು ಡೀಲ್ ವಿತ್ ದೆಮ್. ಯಾಕೆಂತಂದರೆ ಜಗತ್ತಿನಲ್ಲಿರೋ ಎಲ್ಲ ರೋಗಗಳಿಗೆ ಮಾತ್ರೆಗಳು ಸಿಗಲ್ಲ. ಆ ಥರ ಸಿಚುವೇಶನಲ್ಲಿ ಈ ಥರ ಆಪರೇಷನ್ಗಳು ಬೇಕಾಗತ್ತೆ, ಇದರಲ್ಲಿ ಪ್ರೊಸೀಜರ್ಗಳು ಬೇಕಾಗುತ್ತೆ. ವಾಟ್ ಎವರ್ ಬೆಸ್ಟ್ ಅವೈಲಬಲ್ ಇನ್ ದ ವರ್ಲ್ಡ್, even though it is not ideal. For example, a magic tablet would have been good for everything. ಬಟ್ ಈ ಥರ ಸಿಚುವೇಶನ್ಗಳಲ್ಲಿ ಆರ್ಥರೈಟಿಸ್ ಬಂದಿರುತ್ತೆ, ಪ್ರತಿನಿತ್ಯ ಜೀವನದಲ್ಲಿ ನೋವು ಬಂದಿರುತ್ತೆ, ಮಾತ್ರೆಗಳು ಯಾವುದು ಜಗತ್ತಿನಲ್ಲಿ ಅದಕ್ಕೆ ಇಲ್ಲ. ಆ ಸಿಚುವೇಶನಲ್ಲಿ ಆಪರೇಷನ್ ಮಾಡಿಸ್ಕೊಳ್ಳೋದು ಕಂಪಲ್ಸರಿ ಆಗುತ್ತೆ. ಜನ ಆಪರೇಷನ್ ಅಂದ್ಕೊಳ್ಳಿ, ಅಯ್ಯೋ ನಮ್ಮ ಆಪರೇಷನ್ನ ಮೋಸ್ಟ್ಲಿ ಹಾಸ್ಪಿಟಲ್ಗಳು ಸುಮ್ಮನೆ ಮಾಡ್ತಾ ಇರ್ಬೋದು, ದುಡ್ಡುಗೋಸ್ಕರ ಮಾಡ್ತಾ ಇರ್ಬೋದು. ಡಾಕ್ಟ್ರುಗಳು ನೋಡಿ ಹೇಗಿದೆ ಅಂತಂದರೆ ಕಮ್ಯುನಿಟಿನಲ್ಲಿ ಇಟ್ ಬಿಕಮ್ ಸೋ ಡಿಫಿಕಲ್ಟ್.
20 ಇಯರ್ಸಿಂದ ಭಾಳ ಸಿವಿಯರ್ ಇದ್ದು ಮನೆಗೆ ಅಡ್ಡಾಡಕ್ಕೆ ಆಗ್ತಿದ್ದಿಲ್ಲ. ನಾವು ಅಮೇರಿಕಕ್ಕೆ ಹೋದರೂ ಕೂಡ ಅಲ್ಲಿ ಕೆಲವೊಂದು ಸ್ಪಾಟ್ಸ್ ದೂರ ಹೋಗೋಕ್ಕಾಗಲಿಲ್ಲ. ಯಾಕಂದರೆ ಈಗ ಕರ್ಕೊಂಡು ಹೋಗಿ ಬಿಟ್ಟು ಹೋದ್ರೆ ಸರಿಯಾಗಿಲ್ಲ ಅಂತೇಳಿ ಅದಕ್ಕೆ ಕಂಪ್ಲೀಟ್ ನೋಡೋಕ್ಕಾಗಲ್ಲ. ಒಂದು 25-30 ಪ್ಲೇಸ್ ಅಷ್ಟೇ ನೋಡ್ಕೊಂಬರಾಗಿತ್ತು. ಆಮೇಲೆ ಹಾಸ್ಪಿಟಲಲ್ಲಿ ಕೂಡ ಒಳ್ಳೆಯ ಸರ್ವಿಸ್ ಕೊಟ್ಟಿದ್ದಾರೆ ನಮಗೆ. ಅವರು ಡಾಕ್ಟರ್ಸ್ ಆಗಲಿ ಮತ್ತು ನರ್ಸ್ ಆಗಲಿ, ಇವನು ಫಿಸಿಯೋಥೆರಪಿಸ್ಟ್ ಆಗಲಿ ಭಾಳಷ್ಟು ಕೋಪ್ರೇಟ್ ಮಾಡಿದ್ದಾರೆ. ಅದಕ್ಕೆ ನಾವು
ಮೊದಲೆಲ್ಲ ನನಗೆ ಭಯ ಪಡಿಸ್ಬಿಟ್ರು, ಆಪ್ರೇಷನ್ ಮಾಡಿಸ್ಕೊಂಡ್ರೆ ಓಡಾಡೋಕ್ಕೆ ಆಗಲ್ಲ ಅಂದ್ಬಿಟ್ಟು. ಅದಕ್ಕೆ ನನಗೆ ಮಾಡಿಸ್ಕೊಂಡಿರಲಿಲ್ಲ. ಈಗ ನನಗೆ 25 ವರ್ಷದಿಂದ ಇತ್ತು ಈ ಕಾಲು ನೋವು. ಒಂದು ಕಾಲು ಮಾತ್ರ ಇತ್ತು ಕಾಲು ನೋವು. ಈಗ ರೀಸೆಂಟಾಗಿ 2 ಕಡೆ ಕಾಲು ನೋವು ಬಂತು. ಹಾಗಾಗಿ ನನಗೆ ಯಾರು ಸ್ವಲ್ಪ ನಮಗೆ ಪರಿಚಯದವ್ರು ಹೇಳಿದರು, ಫೋರ್ಟಿಸಲ್ಲಿ ಡಾಕ್ಟರ್ ನಾರಾಯಣ್ ಕುಲ್ಸಿ ಅವರು ಚೆನ್ನಾಗಿ ಆಪ್ರೇಷನ್ ಮಾಡ್ತಾರೆ, ರಾಬೊಟಿಕ್ ಅಂತ ಇವಾಗ ಟೆಕ್ನಾಲಜಿ ಬಂದಿದೆ, ಹಾಗಾಗಿ ನೀವು ಮಾಡಿಸ್ಕೊಳ್ಳಿ ಅಂತ ಹೇಳ್ಬಿಟ್ಟು ಹಾಗಾಗಿ ಬಂದು ಡಾಕ್ಟ್ರನ್ನ ಕನ್ಸಲ್ಟ್ ಮಾಡಿದ್ದಕ್ಕೆ ಅವ್ರು ನನಗೆ 2 ಕಾಲು ಮಾಡಿಕೊಟ್ರು ಚೆನ್ನಾಗಿ.
Actually, I was suffering with osteoarthritis since very long. Actually, it is our family, even my sister also got it operated. Of course, she got operated around 15-20 years back. But she used to always complain, a lot of pain. Maybe those days technology was not good and there was some infection also happened. 3 times she got the surgery done. And quite recently, even my younger sister, she got it done in Chennai, in some hospital. Of course, it is non-robotic. She was complaining with very severe pain after the surgery also. So with all that, I was really scared that going for a surgery is not a good option. Because of the experience of the things which who have expressed it. Then I was really concerned, but I was somehow managing. But my situation has come so bad that my legs have bent almost 5 degrees. And it has become a very, very difficult even to walk. Of course, several solutions people have suggested that you go for an injection where they will inject your platelets and that will fill the gap. In fact, in 2022, I came and met doctor. I asked him that please give me your opinion on this particular kind of solution, what others are suggesting. Without surgery, this can be operated. Then, yes, really technically, I am actually a mechanical engineer. He explained me how that much gap that is available, nearly about 2 to 3 mm gap is required. How at this age particularly, and this one it can fit, and how the without surgery, how the bend can be changed. It is all people are misleading the public and doing this one. I was really convinced scientifically his argument. And then, but still my mind was not made up, and he told me to improve your quality of life, you better undergo surgery. But even then I went back, let me keep managing how long I can manage. But after I was keep searching for the, to be honest, a good doctor online and asking several people's opinions. I have come across most number of people I met and their parents, they were anonymously, they are telling Dr. Narayana Halse is the best doctor. My parents have got it done and they are all quite happy. Even my doctor or any doctor also suggested, please go to Narayana Halse. In fact, my house is just opposite to Manipal Hospital. But my family said it's quite comfortable, Manipal Hospital. Why do you want to go all the way to Bannerghatta road and got the surgery done? I said it is not that operation, what matters is the doctor, surgeon. And also I have gone through in the web that within 2 years, nearly 1,500 surgeries were done with robotic. So I was very much convinced that I should go to this doctor only.